Welcome to Meddy Simplified. Today we are going to discuss the questions which came today in the recent FMG December 2019 exams. So these are the recall images. Some of all the images are not the same exactly which was there in the exam, but yes, they resemble somewhat to the original picture. So okay, so let's start with it. First image was this. In this it was asked about this, what what is this picture describes, and this thing is dendritic ulcer, no doubt in it. And the dendritic ulcer is usually seen in dendritic ulcer is usually seen in viral keratitis, and the most common cause of viral keratitis is herpes simplex virus. And the option was given in the exam, herpes simplex keratitis was the correct answer for it. Going to the next question, this dendritic ulcer image was somewhat similar to this, but this next image, which was this keratoconus image, the same image in the exam was somewhat bluish in color, but and the history was given of a girl who was frequently changing her glasses. So what is the diagnosis? And with the same image of the keratoconus it was given, so the correct answer for it was keratoconus. Another question on keratoconus which was given in the exam was Fleischer ring is seen in, and the answer was keratoconus. Other options which was mentioned in the exam was Wilson's disease, but in Wilson's disease we see Fleischer ring. So this was the next image. This image is of festooned pupil. This image is of festooned pupil, which is usually seen in anterior uveitis, and the correct answer was anterior uveitis for this. Coming to the next question, a very famous brachial plexus was given in the examination with this numberings which we have already mentioned here, the number 1, 2, 2, 3 and 4, and they asked to tell what these numbers are, and the option were like lateral medial posterior cord with pectoralis major muscle, with pectoralis minor, medial lateral posterior, and some combinations were 4 combinations were given, and the correct answer for this was and the correct answer for this was medial lateral posterior cord and pectoralis minor, not artery, pectoralis minor muscle. I'll just correct it, pectoralis minor muscle. So this was the image from anat. Another image of anat was given, in which they asked about pterion in which they asked about pterion. The answer was pterion. Other options which were given was bregma, asterion, etc. Another options were bregma, asterion, and some different, but the answer for that was pterion without doubt. Next image was of this beautiful sandfly, and the question was the following is responsible for all the following image is responsible for all except the correct answer was Chagas disease. Other options which were given was Kala Azar, Oriental fever, Oraya fever, etc. But the answer was Chagas disease. And another question another question with the same answer like keratoconus was redo vid bug is responsible for, and the answer was Chagas disease. Coming to the next question, this is not exactly the similar question image, but image was there, and for which the answer was port wine stain, which is a congenital condition seen. And the next image was from this image from obscana. Once again, not similar, the both the thing were very close to each other. It was an open abdomen, but the thing is, in that it was clearly visible that it is a ectopic pregnancy. It is a ectopic pregnancy. So the question and the answer for this image was ectopic pregnancy. Now the next, these labelings were not there in the paper. This testes and epidermis. There was a bifurcation in them. There was a line, clear line between these two images. Something like this was given, and they asked about this arrow. They asked us about this arrow, and the answer for this was testicular torsion. The answer for this was testicular torsion. And the question was there, cryptorchidism is, and the answer was undescended testis. Now this image was given, and it was written that this is having a lateral norm. So the answer for this was Mansoni. Other options were given Hematiconum and Japanicum. Next, this thing was marked, and it was asked for the which artery passes through this area, this red area, which artery passes, and the correct answer for this was posterior tibial artery. The other options which were given were medial plantar, lateral plantar, and anterior tibial artery. Next, this creature was given, and it was asked what is it. A history was given actually, and what is this was asked, and the answer was Burkholderia malai. This next question, this image is there from, not the same image, a similar image from FMT. I guess you can give it in the forensic medicine and toxicology subject, epidural hematoma or extradural hematoma. And the similar thing was given on an NCCT, of head, NCCT of skull, I mean to say, and the same answer for both the question, it was epidural hematoma. There were few more images, I guess from there were few more images on x-rays. There were few images on 4 images, I guess, on chest x-ray, out of which one was tension pneumothorax was the answer, and another one, the option was given tension pneumothorax, and they asked about which side the thorax, the mediastinum has shifted, trachea has been shifted. So that was all. That is what I have collected till now. Will soon post many other questions of the exam, till then, thanks for watching. Please send us questions on Facebook or Instagram, and for more updates, please like, share and subscribe my channel, Meddy Simplified. Thank you.